Okay, good afternoon, everybody. I'm Johannes Frühhoff, CEO and founder of Lab Central, and I'm thrilled to be here this afternoon with you and joined by a panel of experts for our seventh installation of our series Innovation in Biotech in the Time of COVID. This afternoon, we want to talk about lessons learned at our companies from the first step of reopening, how companies and institutions are responding to the reopening after the COVID lockdowns. I'm joined this afternoon by Dr. Gerhard König, a neuroscientist and CEO of Arcuda Pharmaceuticals, a company he started at Lab Central and that has recently moved out. Gerhard graduated from the University of Heidelberg, that I, with some bias, describe as the best university in Germany. I also did a stint there. He's an expert in neurodegeneration and served many years in big pharma with Bayer before leading science at Forum Pharmaceuticals. Also joined this afternoon by CA Webb. She's the president of the Kendall Square Association, who is a local leader here in Kendall at the intersection of innovation and entrepreneurship and community. Previously, CA had rebuilt and ran the New England Venture Capital Association, an active group of venture capital investors looking to advocate for innovation and entrepreneurship in New England. CA founded a venture capital fund, Underscore, and also a foundation, Trinity Boston, and is very active with a number of other non-profits, serving as a board member for MassRobotics, Resilient Coders, the Boston Foundation, and several others. She's a graduate of Wellesley College and Simmons College. So thank you very much to both of you for joining us this afternoon. Now we're live. I'm missing CA. Here you are. Now I see you. Good afternoon. I think so. We're entering this discussion, and we'll have a half an hour discussion approximately before we can turn it over to the audience, and we'll be able to have some live questions from the audience. However, I think it's very important for us in this week to address the elephant in the room, which is that the nation is in mourning and communities around the country are up in arms and in protest against the senseless murder and killing of Black people. And most recently in Minnesota, but before that with atrocious regularity in other cities. We, as business leaders, we have to really think, how can we do our part, and not just with short-term activism, but with long-term impactful initiatives. We are looking at Lab Central. How can we review our hiring practices? How can we review our purchasing practices to try and make an impact by mentoring, teaching, buying from people and groups who are otherwise underserved and underprivileged, so that hopefully this cycle of inequality can be broken eventually, that leads to this racism. With that dark cloud upon us, we do want to turn to the topic at hand, which is, how are we preparing our companies to come back after the mandated stay-at-home orders and lockdown? All of us are running companies or businesses, or in your case, CA, even an association of many businesses, innovation businesses in Kendall Square, and they're all looking to us for guidance. I remember I happened to be on Gerhard's board at Arcuda, and I remember having a board meeting there just a week after they had moved into their new space in Watertown. And this was just like the week before the COVID shutdowns happened. So maybe Gerhard will start with you asking, how has Arcuda lived since then? How is your new lab space coming along? Is it getting any use? How are you coping?
Yeah, thank you, Johannes. And, I also want to just acknowledge you really spoke very well at the beginning. I just want to endorse your statement here, if that's the right way of saying it. I personally also feel very affected about this. And so does, the people I talk to as well. So thank you for these words. So as you said, we had our board meeting, I think it was March 5th, if I'm not mistaken, which was really the week when most of us heard it from Europe and from Asia, what's going on. And we saw the wave coming. But clearly it wasn't as here as it started hitting us later in end of March and April, as you all know, and the listeners and the audience will know. So we had the meeting on March 5. We were talking about it. Well, what if? And one of our board members actually from Pfizer actually said, it might be that we might be shut down next week. Well, and that was what happened, right? The week thereafter, which was, I think, March 10 or so, 11. That's really when we started slowly shutting down within two days. And then I think the stay at home, stay in shelter was March 18 or so. From the governor. And during that period, we really, like many other biotechs, ramped down dramatically. Just for the audience, at that time, we have 18 employees. Within a few days, we got, and of those 6 and 7 work in the lab, our bench scientists, which were very, working well while we were at Lab Central in our suite. But, space was a little bit tight there for us. So it was time for us to move out. I think if it would have happened to us 4 weeks later, meaning if we would have moved or tried to move 4 weeks later, we might not even have been able to move because we might not have gotten the permissions from Watertown, is where we are now in Arsenal Yards here in Watertown. Like many other companies, I can say that comparing notes with other CEOs, we probably almost overshot a little bit in our very stringent way, how we did things. So we had initially only 2 or 3 people coming in, doing only the absolute essential work in the lab. All the other 15 or 16 employees stayed at home. All non-bench scientists, even to now, up to 2 weeks ago, always stayed at home. So the whole management, leadership, including myself, not today, actually today I'm in the office, which I'm very happy about. But all the management and leadership stayed, worked from home. And so after we got used to it, if there's such a thing as getting used to this crisis, we started ramping up a little bit because we had compared our procedures and our protocols with other companies and started getting more comfortable with how we're doing things. So by now, I would say we're up to 75% of normal capacity doing lab work, which means the bench scientists are able to work. I should say we are lucky in that, if there's such a thing to say during a crisis like this, because we just moved and our facility is built for 38, 40 individuals. We have bench space up to 12, 14 individuals. Since we have right now 7 people working at the bench, you can imagine that actually we have a relatively good social distancing situation, which I think makes everybody feel more comfortable in those times. And like everybody else, we have the typical, the typical protocols established, which was a nice thing to actually experience during that period. Also, that a lot of companies compared notes. If somebody found out something in interpretation, whether it's legal, human resource, or whatever, we always helped each other. So that was a very nice thing. Actually, was organized by Jody Morrison from Cadent, who early on in March got us all together. By now, more than 60 companies are comparing notes every Monday morning. That was hugely helpful.
That is a great resource. I've heard of that group. We haven't been joined so far, but I think the sharing of experience, I think, is going to help us navigate a crisis that no one is prepared for. No one learned about this. And of course, CA, you have I don't know how many members the KSA now has, but I'm sure it's dozens, if not hundreds, of little companies, and it's a very mixed bag of. You have restaurants in there, I remember, lots of real estate companies, and then the big ones like Microsoft and so forth. I'm sure they're looking to you to guide them as well. How are you informing your members? Do you have a process internally to share, like Gerhard says, best practices among them?
Absolutely. That is what we do. Johannes has actually served on our board, and Lab Central is a valued member that we love partnering with and have learned a lot from. But I also just want to take us back for a minute before we go forward and just thank you, Johannes. Thank you, Gerhard, for acknowledging this moment we are all living through. It is a moment of incredible darkness in this country. And, you know, I think there are actually some strong parallels between the confrontation we're in with COVID and the reckoning we are beginning to have around racism in this country. And I think if communities like ours can address racism with the creativity and commitment and urgency that we are confronting coronavirus, I think we can begin to change this country. And I know from my own personal diversity, equity, and inclusion work, and from the journey that I've been facilitating for our association, it's not one thing, it's so many things. And the ideas you illustrated at the beginning, Johannes, about how the Lab Central team has been and is continuing to dig into your supply chain, where you spend your money, your hiring practices, your marketing and recruiting practices, the way you run team meetings. If you're a manager who did not acknowledge yesterday in your Monday staff meeting or team meeting what happened the night before in Boston and what has been unfolding over the previous week, that was a missed moment of leadership. And your people heard that silence. And you still have time to get it right. You still have time to go back and create space. But anyway, I want to thank you for that. And we're reckoning with all this over at the KSA. You know, fundamentally, what are we? We're a community platform. We enable the future by connecting the people changing the world. We have a couple hundred members, as you said, the largest employers in Kendall Square, like a Microsoft or a Biogen or a Sanofi, and then many startups and rapidly scaling companies. And then those great Main Street businesses, you know, the small retailers and restaurants that are our watering holes, our places where we commune to keep the business going, to keep exchanging ideas, to socialize. So we've been connecting with all of them since that very first weekend that we started working from home. And wow, I mean, what we're seeing is that the imperative of a platform like ours is even more important as everyone's yearning for information. I mean, what is the greatest currency right now? It's access to information. Now, if you can couple that access to information with some strong decision-making by leaders who can keep us moving forward, we're actually in a pretty good place. So we have been bringing together subgroups of our membership since that very first week that we all started isolating. And it began by just bringing functional groups together, you know, heads of HR, heads of talent, facility ops, site leads, and so on. So they could just start to calibrate against one another and understand what other people were thinking about and grappling with. And then we've evolved from there. And I can talk some more about that over the course of this call.
Yeah, I'd love to hear what comes out of these discussions. I know that, like, when I was on the KSA board, a big topic that we talked about is how can we keep this place growing and flowing? And that's not with cars, right? It's with the T, with the red line, and maybe bikes and other such solutions. Now, I'd be scared to ride the T today. And so we can't really ask of our employees to do that, right? Like, so I don't know, I don't want to put you in a difficult position. It might be difficult to answer, but I'm sure that you have thoughts around, like, how do we do transportation in times of COVID, especially if we need to advocate for public transportation, or else Kendall Square will not continue to grow. There's not enough room for cars and streets. Right. So how do we solve for that?
Yeah, I mean, in the United States, Kendall Square is truly a leading edge model for transit-oriented development. 40% of our people pre-COVID got to work every day not by car, you know, by transit, biking, walking. And Kendall Square was designed to realize that. So we don't have huge parking decks in Kendall Square. We have limited parking, and we like it that way. Because we lean pretty progressive. We all are scientists and engineers. We acknowledge climate change. We understand that we need to reduce emissions, not increase it. So there are a lot of reasons to like the fact that we haven't designed it to be a car-centric place. At the same time, you know, CDC guidance says get in your car. And so we have to reconcile, you know, we have to deal with that. We acknowledge that we have members, we have companies that we work with who have said they will not let their people take transit to work. At the same time, we all have employees. Broad has, you know, scientists who don't have cars. CIC has security workers and employees who don't have cars and don't want cars or can't access cars or can't afford cars. And so we cannot presume that everyone will be able to drive to work. So we're going to continue to find ways to get people here safely. We are pushing the T hard to increase frequency, to get those new red line cars in that are more reliable, that mean that we can have more trust in the T. You know, I have a lot of questions, like many people on the Zoom right now. You know, I think if it's okay for us to get in elevators and go up 20 floors, why isn't it okay to get on a bus? You know, so long as we're practicing healthy practices, wearing our masks, washing our hands. We're going to learn more. I mean, we're getting new data with every passing week, but anyway, we're doing all the things we can to push the MBTA to be as safe as they possibly can, and acknowledging that we're having to do a lot of things that won't make sense for the long term in terms of keeping us healthy as a community. But for the short term, we may need to amend some of our practices, like driving more.
Yeah, I know, Gerhard, you used to be here, and now you're out in Watertown where parking is easier, and there's not a subway going there anyway. So probably that transportation question is not one, but I'm wondering about productivity in a lab. Like we talk about, we built these places for scientists to have meetings, right? Because we believe that in order for them to be productive, they need to have lots of input from many places. They need to discuss their experiments and failures with colleagues who come from other disciplines. Now, all of that is not happening, right? Like on Zoom, yeah, we have our meetings on Zoom, they're scheduled, and we talk about the agenda of the topic, right? But then all of the side conversation can't happen. Are you seeing productivity in your company? You said you're back to 75% of
Yeah, and that might be conservative. Maybe it's even more, but you know, it is 75, 80%, right? That's sort of position. But I think we're almost there full time with the bench scientist. And again, our situation is a little bit different than the average because we just moved into a new building with more space. One of the things we early on realized through this task force of the Monday morning CEO session, there was a task force, is how can we actually increase the safety of the people going to work, right? Being at work. And I think that's a very fundamental thing where we very quickly realized it's about testing. And maybe, trying to stay positive because the government is not able to actually provide it to you. I think here is a private initiative of all the companies involved. And I want to mention one particular individual, Katirizan, he's the CEO of Webb. He was sort of leading us in that because he had connection to the Broad and connection to the MGH. And we came up by now, we have this pilot program, which you started making a mention, which part of that 60 or so companies, 12 participated in a pilot program where we each week, once every individual who goes to work asymptomatic gets tested at the Broad, where they go in, they're scheduled, they go in, they go out. It takes about 5 minutes. Health practitioner and a physician is on site. And we do the swab test, the nasal swab test, not the one with the long needle or the long swab, but the shorter one, the lower part of the nose, so it's more comfortable. We're now in week 3. We have tested more than 380 or so individuals of the 12 pilot companies, And we're happy to report that 0% are positive, with not a single case of positive. Lots of thinking has to got into that. I mean, it sounds easy, like, well, let's just do an RT-PCR, right? It's not so complicated. So it was not easy to get this off, but now we're happy to have that. I can report that, of our individuals, except 2, who for reasons, which is transportation, they cannot actually get to Cambridge, so they were excluded in that pilot program. But the ones who did go, I think, from what I heard and from what I hear from them, is they feel safer because they know I am not positive, my colleagues are not positive. Well, then I argue you have enough space here. So this is for sure safer than Trader Joe's or wherever you go, right? If you go shopping. And I've made that argument quite some time now. And I think they agree. So coming back to your question, if we want to get back to a normal, to have that more interaction, we need to really get our act together and quickly test asymptomatic individuals so that we get down to really almost 0. We're not there yet. So that's one thing we can do. Now, I haven't answered your direct question about how do you get up to productivity to have that spontaneous, hey, I'm going to walk down. It's like, have you seen that paper? And that's really, I don't believe that. You need to stand to it. You need to see each other. And that's more difficult in a Zoom environment where you have a scheduled 2 o'clock to 3, we'll talk. And then afterwards, I need to talk to Johannes, and it's like, what do you make of this, right? So I need to call you up again, or another Zoom call. And I think that's where the Zoom world has a limit. It's great, but that's where that fertilization of personal interaction, of people talking to each other and getting comfortable also, telling them really what they think, not just over a screen. I think that's a limit, and I don't have a good answer for you yet, but I think we need to get there. But to get there, we need to make it safer, and that's one step we were able to do at least. It's a first step. It's not this.
Do you think we'll be able to get to affordable solutions with testing like that? I don't know how much does it cost your company to have your people tested once a week?
Yeah, so it's a good point. It's about $130 roughly per individual per test per week. So it's $640, right, per month per individual. We'll carry it. I mean, I said jokingly, well, heck, we're not traveling, so might as well spend on testing, right? So, but it's a cost factor, so we need to bring down the cost. That's where the antibody-based tests maybe come in. They're much cheaper, as you guys know. The RT-PCR is just very expensive. And it's also, that leads us then more like, this is the active test, right? So next question is, well, did anybody of us had it? Did we have had it? So in other words, could we potentially be immune? We're not there yet. It's something we're looking into, and that's sort of what the task force is trying to get to as a next step. How could we potentially have more certainty? But we agreed first, which is getting a handle on the active asymptomatic carriers. That's the most important one.
Yeah,
and like everybody. Yeah.
Thank you, Gerhard. CA, do you know about other such initiatives in and around Kendall? Because I think what Gerhard is mentioning is such an important factor for the well-being of our employees, right? Is that, yeah, if I'm asked to come to work, I want to feel safe at work at least. Yeah. I don't want to feel like I'm taking a risk for my family. What's going on there?
Right. Yeah, and it's about physical safety and as you say, psychological safety and the comfort and safety of our families. So we started something called the Future of How We Work Task Force. And we've gathered the largest employers in Kendall Square for 3 weeks now to talk about different facets of reopening. The first was devoted to transportation. The second was employee safety. And we had Broad Institute come and present their multi-point plan, which includes a very aggressive testing protocol. And as you heard from Gerhard, other companies have been able to access some of those resources too. They also, as you know, were on the front lines at the very beginning of this, repurposing one of their labs for testing, and we're within 48 hours, I think, running 1,000 tests a day and have capacity now for about 25,000 a day. So Broad has just been an amazing contributor during the time of crisis. They're working with a company called Color that is helping with their testing protocols. We also had the CIC present to this group, and they walked us through all the research they've done and their several dozen new practices and protocols they've implemented in their centers to give peace of mind and to create a Swiss cheese approach, they're calling it, to testing, where the virus might get through this layer, but you've got so many other redundancies and layers that ultimately it becomes very, very, very hard for someone to become infected. They have also pulled together a consortium, a purchasing consortium. So if there are people listening right now who might want to join that consortium, they can reach out to me, or if you know Tim Rowe, you can email Tim Rowe directly. But they're working to get the costs down. But as Gerhard said, we're hearing from companies across Kendall that it's been pretty easy for them to spend funds on employee testing, whether you equate it to the travel budget that you're not spending anymore, or you think of it as some form of an employee benefit, or just frankly an essential protocol as a matter of doing business, cost of doing business. Most companies are beginning to roll out these testing programs.
Yeah. And just for the record, it's exactly the same group. Like CA said, it's the Color Genomics combined with Broad, which have been really phenomenal. I mean, so I consider us to be actually privileged as a community, but also as a company to be able to participate there, because to CA's point, it's not only you go in, you're safe, but you go home and you can tell your family, I am not infected. Right now, I mean, it's maybe changing soon, but the only way, at least a few weeks ago, you were able to actually know is either you get so sick that you are qualified to actually get the test, or you make it up and say, like, I have somebody at home who is maybe, at risk, and maybe you get the test, but it's, normally you cannot get tested yet if you're asymptomatic.
Yeah.
So if we imagine a world where testing will be more widely available to employees, that could help bring us back to some level of normalcy. However, I mean, many of the office, and I understand that, of course, for your lab workers, right, Gerhard, because they have to be at the bench, or production people who have to assemble stuff, right, manufacturing. For the office, what are you seeing the future of office look like? How do your members that are big commercial real estate companies respond to that? Should we short our real estate stock? I mean, what's the future there?
Well, everyone's asking, and certainly we have in Kendall Square, we have 7 major developers that in essence own all of Kendall Square, and several of them are on our board of directors, and I know all of them personally. And I can tell you, they have not lost faith in Kendall Square. I mean, yes, there are companies that will decide to move in the short to medium term to suburban campuses, but there is still such a strong argument to be made for the kinds of companies that plant themselves in Kendall Square to be across the street from MIT and to be able to walk across the street and see one another. So we're not worried that Kendall Square is going to go away. But at the same time, I do think this is a moment that prompts, another diversity, equity, and inclusion question, which is, I can hear my 4- and 6-year-old, down the stairs. A lot of us are home with children right now. I know you are too, Johannes. I think, Gerhard, yours are older. But until we all have children back in school and childcare that's, safe and available, we're going to have to continue to be incredibly flexible. So as I've met with our members and asked them how they're addressing that, many of them have moved to 7-day work weeks and allowed, their people to set their own schedules. Many people are operating on shift schedules. A lot of employers are saying, if you need to go in and be in the lab or office, please be there as briefly as you can. Again, just to limit possible exposure. FaceTime has gone away in that sense, right? It's do your work and deliver your deliverables and take care of yourself. But our major employers are the kind of next wave of reopening is working on new childcare benefits and offerings. And so we'll continue sharing those back with the community as we gather, aggregate information, gather best practices. But that's obviously a big part of this puzzle.
And it may not, I mean, what if schools don't open in September, right? Then this continues for much longer.
Well, I just thought you made it easier for me to answer the question by just talking about an immediate future. I do want to, bring it back again, what we started out with. These are difficult times, but I think that's also, COVID as well. We need a little bit more empathy in this whole discussion. So like Sia just said, everybody has their own challenges. So if you have somebody where both partners work and their kids are at home, right? So now school is out. Well, guess what? Summer, what are we going to do? The summer camps have been canceled. So we just need to, make it up and individualize the response as we go along and recognize that, right? If I just argue from one person's perspective of their individual situation, they might have the means, the money, or they might have the space to work efficiently from home, right? Some people actually work from home. They don't even have a real office, right? So it's difficult for some people. And that's where we just need to be a little bit patient, right? And come up with individualized solutions. We have this too. One individual, for example, she could come in and she has a driver's license, so we provided a rental car. Now, I'm not promoting car driving, don't get me wrong, CA, right? I'm with you, global warming is a fact, but that's just an example. We need to come up with solutions for that people actually feel we care for their hardship, because one thing is for sure, anxiety goes through the roof in those times, right? People are anxious because they can't manage their private life like before, because for the situations just described. The kids are at home, they don't get up. In my case, they don't get up. As I joked with the two of you when we talked first, they get up by the time I had my lunch coffee. Well, that makes life difficult for the family too. So I think summer is going to be tough. Summer is going to be tough, and it's going to be flexible. I think, Johannes, coming back to September, what's happening in September? I think if the schools are functioning, we don't have a second wave. I think we want to coming back in general, we aiming for, I think the community coming back, like you said, CA, purposeful going back to the office with a purpose. I'm going to meet CA because I really have this difficult discussion with her on something. Or I'm a new employee, I've never met her in person, right? Onboarding, we haven't talked about that, but we all think we want to grow and expand. So if bring somebody new on board, it might be good to have a first meeting that subsequent Zoom calls or telephone calls get easier. So I hope school will be in session, but if not, it's going to be a slow back to normal, slower than I hope.
Yeah. Yeah, and one thing I would just add to that is early in this, and I'll try to find the citation in case you want to share it back, but early in this, I saw a report that submissions of academic papers by women academics had plummeted within the first month of the pandemic beginning here. And this is a huge consequence. Yeah. It's a huge consequence to science and humanity. And it is of huge consequence to equity and to these talented people being able to realize their academic careers. And I said that to a friend of mine who works in business, who is married to a tenured academic. And he literally did a face palm to me and said, CA, I am so embarrassed. I've been, she has the flexible life. And so I've been letting her do all the homeschool for our two boys. And I've been on nonstop Zooms 12 hours a day. And shit, you're right. She still has to publish. What am I doing? And so it's like, we need to keep having these conversations and thinking about the potential inequities, not just today, but the long tail ones, because they're of enormous consequence to all of us.
Yeah, and I think that's a really good point. I feel like I'm home much more often. There's more equity in my house than there used to be. But of course, it also goes in the other direction. We are getting a bunch of questions here now from the audience. Let me tie some of those in. Here's one that relates to the scientific response to this, and I think it's a very timely question, because we perceive Kendall Square to be this super innovative place of discovery and science, and we want our decisions to be scientifically grounded, not just silly protocols. And then the questioner asks, how do we continue to align protocols or to right-size protocols in a timely way, given the continued flow of updated scientific information? I feel like maybe I can start with that before I ask, because we're at the forefront of this as well with Lab Central. We have continued to look at the literature week by week that came out. And I think we have learned a great deal since late February, beginning March, when we started to pay attention about how this thing transmits. I remember that when we first looked at this, we were so afraid of like stuff sticking to surfaces of the table. We now know that, yes, the virus does live there, but very likely is a minor source of actual infections, whereby the airborne infection is really the one that we have to worry about. So I think we are learning a great deal. I hope that these new learnings will translate into the guidance that we get back from the government, because while we are scientists, we think that we understand this, we have to subject and operate within the government guidelines. CA, is the KSA involved in helping the government come to the right conclusions? Do you have an audience there, or is that not your thing?
We've been in touch with MEMA, with the Secretary of Economic Development and the governor's office throughout this. They didn't invite us to be part of the reopening plan, but they have many other smart people at the table. We've also been advising the city of Cambridge, and there have been many people in Kendall Square and MIT that have been advising the Public Health Commission and others on safe practices. I think the audience member's question is a really good and important one. And I think, just as we know individually, we have to remain vigilant, that it's the moment that we start to relax and we go to that dinner party and we shake the hand and we, that this all starts to fall apart until we have that vaccine or fantastic therapeutics or both. So I think our companies have to remain similarly vigilant. The COVID task forces that all of our companies have created, they don't sunset next week because we're in phase 2 of the governor's reopening plan. They are going to continue for months to come. And we're going to have to remain wide awake and examining exactly that question. Is what we believed in last week still true? Has any of it been debunked? Do we need to, to iterate? And just what makes sense next? So stay awake, my friends.
And read papers. There's another one for Gerhard that says, biotech happens through collaborations, and international collaboration is key in that. Now we're not traveling. How do you see the future in, say, next 6 months to 1 year for biotech and international collaboration?
Well, I mean, lots of us have asked that question to ourselves, and we have had group discussions. I think for the time being, meetings will remain virtual for the reasons we know and understand, meaning the next few months. I think probably for the remainder of 2020. I think it's safe to assume not every meeting which is scheduled in November, December might have announced we canceled it, but I would expect there will. If you listen to the experts who study epidemiology and infectious diseases, they also tell you a second wave might be more likely in the cold season. So being in the Northern Hemisphere, November, December is probably when influenza goes up. So for all those reasons, I don't foresee that a typical meeting will happen over the next 6 months in person. So that's maybe the first question I can give. I do think there will be, for example, fundraising for biotech is okay, virtual. right? At some point you meet, and then again, it's not that we're not meeting at all anymore, right? And that's the other thing. We need to slowly come back. Doesn't mean we should party and go out and behave irresponsible, but we can have a business meeting, let's say in September, October, potentially with some parties, or scientists can meet if they have an important project to discuss. I do think the default is probably first virtual, right? But for all the reasons we said before, at some point the human factor comes in, because there's a contract we're entering. If I collaborate with somebody, and the two-dimensional surface of the screen does not always allow that contract. It's like, do I really want to work this guy, Johannes? I mean, do I really trust him, right? That comes, you sit in a meeting and you hash it out, right? So that's my 2 cents. Am I right? I don't know. Future will tell me.
There's a question that talks about employee anxiety about returning to work. I think we touched upon that a little bit, but
yeah,
maybe today you can talk to that as well. How are you? I mean, do you have in your own KSA employees? Are you talking with them about it? Do you offer accommodation? How should business leaders think about this topic? It's one that we don't have any experience with.
Yeah, I mean, again, I think we have to lead with empathy and be human first and foremost. I think that, this moment of coming into one another's homes has given us a more personal window into some of what people are dealing with. But we still don't know. We don't know who has immunocompromised, children or parents living with them or others. I mean, there's so many factors to consider. My message to my team, we're all office workers. And we're in a privileged position of being able to work remotely. And for our team, it's worked incredibly well. And I've said to them, this is a deeply personal decision, and I'm not going to make it for you. You should return to the office when you feel safe, and that's psychologically safe and physically safe. I've asked them for now to limit it and to coordinate with one another, and we have practices and protocols in place. I realize not every company can do that. It can be quite as liberal as what I just described, but I do think it's going to be important to use multiple layers of feedback loops to understand what people are thinking about to inform your decision making, and then after you've made the decision and you've implemented it, to find out what their sentiment is, how they feel about it.
Yeah, maybe just to add to this, as now everybody knows, of course, we have scientists to bench work, and then we have the office components. And that's, by the way, what I see a lot over Zoom. You get to know people much better, which is actually sort of a nice thing too, that you see a little bit their kids and dogs and cats. And then there's a lot of information about those cats and pets, what have you. But anyhow, staying focused on the topic. So one of the things I feel personally very strong about, and maybe it's the upbringing, don't ask somebody else to do something you wouldn't put yourself into, right? And it's one thing for a leader to say, you can come in and we all have it cleaned up and it's safe for you. If you kind of wouldn't, or let's say, would you take public transportation yourself? Well, Johannes, you said it. You're not feeling good about that. Now, that's an emotional response because you don't have the facts. There's no swipe test. How many virus particles are there? And maybe they're not even there, and aerosols. So if you don't feel that, you should ask your employee to do that. So I'm with you there. And so I'm in the office because I want to demonstrate. I'll do that. I don't have actually a purpose right now other than talking to you, and tomorrow we'll work from home again. Well, purpose, I mean, here, I don't have to do my business right now here, but there's a message I think we're sending out, and coming again, back to your earlier, the way we react as leaders to the situations like this is important because people will watch you, and then not everybody will talk about it, but they'll watch you and they will take their own conclusions. And so I think that's how we make this, and this sounds a little bit romantic, a better world, so to speak, by reacting to those situations. So I feel it's important we don't force anybody if they have, even if we argue, it's a little bit an emotional response and a irrational response, right? Because there's no absolute safety ever from this. right? As scientists, we know that. It's a continuum, as an epidemiologist just told us the other day, Johannes. It's not a binary, you're safe, you're vaccinated, go out and whatever. It's not going to work like this, right?
We have to continue to improve the odds.
That's right.
And we'll achieve that through, hopefully, vaccine development, although I'm a little bit doubtful there, fingers crossed, and improved management of disease cases and then tracing. Lots of work to do. I think science can help us find a way out of this. So I'm hopeful, and I hope that our community in Kendall Square can contribute to that and can help with that. I'm grateful for both of you joining us on our panel this afternoon, and continue to do the good work. Thank you for also taking time and acknowledging the moment that we're in, which is an unusual and ugly time, but we'll get through this with everybody's leadership. Thank you very much.
Thank you.
I wanted to call out also for our next week's panel, where we are going to again go back and talk about questions. How does COVID-19 and these new realities affect the real estate that we're all working in? I look forward to seeing you then, and until then, be well and be safe. Bye-bye.